Hey guys, welcome to Hope with Jonathan. I'm your host, Jonathan Traylor. As you guys can see me right there on the front of the screen, I was kind of getting into that music and dancing a little bit. But hey guys, listen, if you're here for a video on what medications I took with cough and congestion while battling COVID, the Omicron variant, stay tuned and you'll get a lot of information about why I took a certain medication for my cough and congestion. Again, guys, my name is Jonathan Traylor. I'm a grateful kidney transplant recipient. And as you guys can see, I'm a podcast host right here on Hope with Jonathan, where we share stories of hope and interview other patients and give them a platform to be able to share their incredible story with battling kidney disease, dialysis, transplant, and much, much more. Listen, guys, if you haven't already, hit that subscribe button. We would love for you to join us right here with us in our family of Hope with Jonathan, with other chronic kidney disease warriors, or if you're just a chronic illness warrior as well, and you've overcome great obstacles, we'd love to have you subscribe to us right here at Hope with Jonathan. It would be amazing. We would really appreciate it and welcome you to our family. Hey guys, with all that being said, back to our video. So guys, listen, a few months ago, I was suffering with COVID, Omicron variant. It had hit me. And I started having a lot of different symptoms, and I've done some other videos on this and kind of covered some of my videos that I have on my channel that you can refer back to regarding my bout with COVID and the Omicron variant. And so I reached out to my team and began to speak with them about some of the symptoms that I had and the medications that I needed to start taking. And I was experiencing a lot of cough and congestion along with a fever, and you can refer to that video I just did past on what to take for fever, or what I did take with fever. But listen guys, before we continue in the video, just want to let you guys know real quickly that this in no way, shape, or form is a diagnosis for treatment in any way, and so always refer to your team. And here's a quick disclaimer on why.
Jonathan is created as an informational, educational, and entertainment show. Hope with Jonathan hosts, guests, partners provide information on the basis of research and personal experiences, and is not to be taken as or implied as diagnosis of any disease or treatment. Hope with Jonathan, its host and guests and partners, recommend and encourage you to speak to your medical team before implementing any treatment or diagnosis found on this show or any product, service associated to Hope with Jonathan.
And there you have it. That's our disclaimer. That's our medical disclaimer. That way that you guys know that this is in no way, shape, or form a form of diagnosis for treatment. But listen, guys, when I reached out to my team, I was having symptoms of cough and congestion for about 3 or 4 days. And even after, it kind of lingered for probably about 2 weeks. I just kept coughing and coughing and have a lot of congestion, almost as if I had like a sinus infection. It was pretty bad. And I reached out to my team, my medical team, my transplant team. When I say my team, I'm talking about pretty much my transplant team. And called them, and they told me that I needed to take something, anything without D in it, which we're going to get into that. It's a decongestion. And let's talk about some reasons why that they said do not take anything with the D in it. So the decongestant that they're speaking of in medications includes like Sudafed and things like that, NyQuil, all these different medications. Even was it Mucinex has one with the D in it. I mean, there's so many different ones. Robitussin, all of these can be very dangerous, especially for patients who are already suffering with ailments such as like high blood pressure, diabetes, and things like that. And so here's some of the reasons why. So number one, decongestants can raise your blood sugars. Decongestants can also raise your heart rate and give you an abnormal heart rate, and it also can raise your blood pressure. And if you don't already know, type 2 diabetes or diabetes in a whole, so you can have type 1, type 2. There's some, a couple of different forms there, but um, diabetes as a whole can give you kidney disease, ultimately lead to kidney failure, and it is a leading cause of kidney disease. Hypertension is number two on the list for chronic kidney disease, and uncontrolled hypertension, uncontrolled diabetes definitely can lead you right to kidney disease and straight to kidney failure if you're not taking care of it. And so here's what happens when you take a decongestant. It can increase your blood sugar levels. And basically, any of these medications that can raise your blood sugar levels, your blood pressure, or your heart rate is not healthy for you, especially if you're a kidney patient. As you guys know, most kidney patients that have suffered with chronic kidney disease, I've already just said, these are leading causes of kidney disease and can ultimately cause kidney failure. So it's not really a good thing to take a medication with decongestant in it when you're already could be suffering with some underlying health conditions such as hypertension and diabetes. And you definitely don't want your heart rate raised or having like abnormal heart rate. That can cause problems with your heart, and if you're already having problems with your kidney and your cardiovascular system would be next. That can be definitely a dangerous thing. So they told me to stay away from anything with the decongestant in it at all. Nothing, no D at all. So what was my medication of choice that I took? Was Corsedin HBP. And I took the Corsedin HBP because it did not include a decongestant in it. But it did include one that was safe for kidneys, and we covered this last video, acetaminophen. So it included a little bit of acetaminophen in it, which was a plus for me because I was already running a fever. And as you know, acetaminophen is safe for the kidneys, and it is a fever reducer and a pain reliever. So I was having, aches and chills, and I was running fever. So taking the Corsedin HBP that uh, did not have a decongestant in it, which was safe, and we've already went over why you don't want to take a decongestant. And but it had acetaminophen in it, so it didn't include an NSAID. So NSAIDs we already know can be dangerous for kidney patients. Okay, such as like ibuprofen, Motrin, Advil, all these different. All these different NSAIDs can be potentially hazardous to the kidneys. And we covered this in the last video where we talked about it suppresses the blood flow to the kidneys, and anything with lack of oxygen, we know eventually is going to cease of living. So we have to be careful of what we're taking, being mindful as kidney patients. Again, guys, this is no way, shape, or form a diagnosis. I'm just sharing my story and sharing my personal story. So I took Corsedin for the recommended time and dosage. It was probably around I think I took it for like 3 or 4 days, and that was pretty much 2 times a day. So I was taking like a cup in the mid afternoon or so, and then toward the evening before I went to bed, then I was taking a another dose of the Corsedin, and the Corsedin seemed to help me. It was it seemed to help with the congestion and the cough. I was also using like cough drops and things like that, and those you have to be careful too because you never know what could be in them. I think my main focus of doing these videos is that we should be reading labels. Always read the fine print on the packaging before you buy any medication, especially if you're a kidney patient, especially if you're an immune compromised patient, or you've already got other underlying health conditions. This is something that you definitely want to keep in mind. Is always reading the back of the box or the small print on the labels. That's where a lot of hidden information is that they don't want the consumer to see. So definitely keep that in mind whenever you're out there and you're buying medication, especially over the counter without a prescription drug. And in all cases, at all times, before you ever take a medication, especially if you're a kidney transplant patient or even a patient suffering with CKD, you should reach out to your team and refer to your team before you ever take any medication. For one thing, you're trying not to cause any more damage or harm to your kidneys. You're also trying your best to maintain, if you're a kidney transplant recipient, you're wanting to maintain your kidney and keep your kidney healthy, keep your kidney safe. So some of these medications that are out there can do your kidney some harm. So you definitely want to make sure that you're protecting your kidney in any way, shape, or form. So definitely read the labels. Definitely reach out to your team. Again, guys, I'm just sharing my story with what I took during my bout with COVID-19 and the Omicron variant. And the reason why that they didn't want me to take the decongestants was because, hey, it can raise your blood pressure, raise your sugars, and also give you an abnormal heart rate if you're not careful. Is this something that you should keep in mind? Absolutely. Always keep it in mind. And listen, guys, I'm not saying in any way, shape, or form you should run out and go buy Corsedin. Do whatever your team tells you to do. If your medical team tells you to go buy such and such brand or medication, or they may even prescribe you some form of medication, do what your medical team tells you. Okay, not Jonathan. But hey, guys, listen again. My name is Jonathan Traylor. I'm the host of Hope with Jonathan. And if you like this video, please, it would really mean a whole lot to me if you would join our family and subscribe to us right here at Hope with Jonathan. Also, guys, check out our website, hopewithjonathan.com. And listen, guys, we also have a free newsletter that we put out, and we'll send you some information on some videos that we've done, some interviews that we would like for you to check out. If you haven't already to sign up to be a donor, you should go over to Donate Life, and you can do that right here on your phone. You can do this right on your phone, okay? DonateLife.net. Sign up to be a donor today. Save someone's life. Over 100,000 people waiting for a life-saving organ. Over 90,000 of them are kidney patients waiting for a life-saving kidney. Please go to DonateLife.net and sign up today. Reach out for support. If you're newly diagnosed, maybe you are looking for a community to join, you're looking for a support group, you can reach out to KidneySolutions.org. Kent Bressler, Vice President of Kidney Solution, is a 34-year kidney transplant recipient, and he's a mentor, he's a friend, personal friend, and he will help you in any way, shape, or form that he can. Reach out to them at KidneySolutions.org. All right. For more great information, go check out kidneyconversations.info. Kidney Conversations, where we educate, inform, inspire. We're trying to send out some blogs, some videos. You can watch some of those videos right here at Hope with Jonathan. And listen, we would love to hear from you. So drop a comment on this video. Let us know what you think of our videos. Let us know what you think that what we're doing with Hope with Jonathan is positive. We really would appreciate it. Remember, guys, to always check with your team. This is definitely something that we want to make sure that we get throughout these videos that we're doing. In no way, shape, or form is this a diagnosis. It's not a diagnosis. It's not. I'm not a medical doctor. In no way, shape, or form do I claim to be a medical doctor. I'm just sharing my information, putting it out there what I did. Maybe somebody's right now they're just kind of questioning what they should do, where they should go, what medications, is this safe, and this, and then maybe you're connecting with me and found me on the internet, and you can see, well, hey, Jonathan, and then call your team, but always refer to your team. Always refer to your team. Questions about medication, questions about anything. There's no such thing as a dumb question, okay? So in no way, shape, or form is this a diagnosis. Also, guys, we really appreciate your support for Hope with Jonathan. And we are definitely trying to share messages of hope right here. We ask for you to please go back through our videos and check out some of our inspiring, incredible interviews that we've done with kidney patients and people that have overcome great obstacles and overcome amazing was such resilience and great strength, inner strength. They got the inner kidney warrior, inner kidney fighter in them. I just did some great interviews with international kidney patients, Fez Awan from England. Also, the TikTok kidney warrior Darren, he's from Wales. Did those two interviews, and those interviews were incredible. And I just finished up with a living kidney donor interview with Carol Offen and Elizabeth Cray, and they have a brand new book, so you guys can go check that out. But listen, guys, we share stories of hope right here on Hope with Jonathan. Hope you guys have enjoyed this video. Hope you guys are staying blessed out there. And remember, most of all, love on everyone and take care of your kidneys. God bless you. This is Jonathan.